Hello, and thank you for joining us. I'm Doreen DeFabo, Human Resources Director with the Municipality of Bethel Park, and I'll be your host for the Live Well Bethel Park program, Navigating Through Life's Challenges. Featured today will be Dr. Susan Panna of the St. Clair Medical Group Internal Medicine. Dr. Panna specializes in internal medicine and is board certified by the American Board of Internal Medicine. She earned her medical degree at the Philadelphia College of Osteopathic Medicine and completed a residency at the Winthrop University Hospital. Join us as she offers information and strategies to help us move through life's challenges and stressors with more ease of confidence. So welcome, Dr. Panna.
Thank you.
Can you please tell us a little bit about yourself and your background?
So I'm a specialist in internal medicine. I've been practicing for 24 years. I initially started in Mineola, New York, Long Island, and had a National Healthcare Scholarship, ended up in California, serving time for the government in an underserved area, and then basically in multi-specialty practice, and have worked for the VA and just a multitude of different positions. Most recently, I was the medical director of a PACE program, more in administration, and then I decided that that wasn't really my thing, and I needed to go back to just practicing medicine, and I joined St. Clair to practice in their internal medicine group.
And you've been with St. Clair
for approximately close to 2 years.
2 years, wonderful. So we know that many people, both men and women, experience fears, anxiety, depression throughout their lives that stem from relationship, family, work-related issues, and more. So can you speak to how you help guide individuals through these experiences?
I think for anxiety and depressions, there's never a quick fix. The most important thing is a self-realization in terms of what causes your symptoms and triggers. And I think with the help of either a mental health professional or your physician, you can kind of get to the source of things. But for the most part, I have a series of recommendations that I give my patients. Of course, they all don't go towards everyone. It's not specific to every person, but in general, the first one is avoidance of alcohol. It's very easy after a rough day at work to go home and have a cocktail or a glass of wine. It relaxes you, makes you feel better. But over time, if that becomes a habit, alcohol interferes with your serotonin levels, and actually in the long run increases anxiety and depression. Not to mention the fact that it can be habit forming and interfere with your family life and work life. The second one is to reduce caffeine. A lot of us can definitely need a cup of coffee or maybe tea in the morning, which is fine. I guess my recommendation is after that to maybe go to water, more natural drinks, just because staying hydrated decreases risk of anxiety. One of the symptoms is a fast heart rate that can actually occur from dehydration. So decreasing caffeine is very important. The third one is journaling. And the reason I recommend that is because it's very good to know after you have a panic attack or an anxiety attack, where and when this happened. What were your triggers? Was it a work event? Was it a football game? What made you react the way you did? And in this way, you can go over it and find your triggers. It's good to review with your mental health professional as well as your primary care doctor. The fourth one is I definitely recommend talking to someone that gets you, understands anxiety. A lot of people feel judged. They feel like people don't take their symptoms seriously. So talking to either your therapist, your doctor, or a friend who also experiences anxiety can actually help you. And sometimes you actually learn from friends who also have anxiety, as they may have the techniques that gets them out of that state, and you learn something new from a friend that way. The fifth one is basically meditation, and a lot of times I know people don't have time for something like that. And what I'm talking about is not something that's 30 minutes or even 15 minutes. Just listening to a song that relaxes you, it's calming, that you enjoy, 5-6 minutes, taking deep breaths, holding them for a few seconds, and then releasing them slowly in a room that you're by yourself would help, especially before work or a stressful event. Exercise, very important, just in general increases your serotonin levels, helps with your physiological health as well as your mental health. The other one would be, I would call it time out, which means having some time to yourself. And this I usually definitely recommend to patients that I have that are new moms. Just a feeling of being overwhelmed by career, a new baby. So having an hour to themselves, even if they go somewhere and sit down and have a cup of tea somewhere by themselves or just sit somewhere and relax, will really kind of help them regroup and improve their mental health a lot.
Thank you. So if left unchecked, how can these emotions affect someone long term?
There's a lot of evidence that chronic stress can affect your neuroimmune axis. So in, I guess, layman's term, chronic stress causes inflammation in your body. And what diseases are associated with inflammation? Cancer, heart disease, type 2 diabetes, anxiety, and depression. So chronic stress can increase cytokines in our body, can increase our stress hormones, and actually damage the inside of blood vessels and cause issues. And so it's very, very important to deal with it and try to find your triggers and get the therapy and treatment that you need.
Thank you. Are there any supplements, exercises, breathing techniques, or anything that you can recommend for that?
I think for the most part, I would say it's more like avoidance of certain things, like as I mentioned before, caffeine, alcohol, meditation is very good. Yoga is very, very useful in that it just relaxes you, calms you down, and very beneficial for toning and getting in shape as well. So more those things are more beneficial, I think, than any kind of supplement. I think a lot of my patients come in with the latest and greatest vitamins they've seen online, and my advice to them is save your money. The things that can help you, you don't need to spend money on.
Great. How do we best maintain psychological resilience?
I think resilience takes time. And I mean, for the most part, all of us have had a trauma in our life that has required resilience to recover from. So sometimes, in a gentle way, remembering what happened to us, whatever trauma it was, and kind of dealing with it and how this happened and what you can do in the future to prevent it. Finding somebody supportive to talk to about what happened to you, and self-care, eating healthy, exercising, sleep, because the brain functions better in recovery of a trauma and building resilience when you take care of the body. And realizing that all of us are choice-making individuals, and all the conditions, the circumstances that we react to, the emotional reactions that we have to things that occur around us are choices that we make. And what we think comes out in what we do. So having thoughts, good thoughts, really does make a huge difference. And realizing that you're in charge rather than others, what they say about you or things that people do to you. that you're in charge of the situation on how you react to it, how much you suffer in terms of if bad events that happen to you.
Many of life's challenges also come from the changes we go through with age. So can you talk about perimenopause? Let me start that. Can you talk about perimenopause and menopause and how women can better cope with the symptoms?
Perimenopause and menopause, they're transitional stages. It doesn't feel like it, but they're transitional stages. And I have a lot of female patients, and every individual is different. I have some patients that go through it with no issues, and I have some patients that are just more challenging for them. The difference between perimenopause and menopause is that with perimenopause, you still have estrogen levels, except they can go up and down more sporadically, even in a 28-day cycle. You still do get your cycle. It can be heavier at times. If you get premenstrual syndrome, it can be a little bit worse than before. And also important thing to know that a woman can still get pregnant in premenopause. But the most important thing is at that stage is small meals are very important rather than big meals in terms of controlling symptoms. Decreasing alcohol, and as even though you can get some hot flashes, actually exercise decreases that. So that's very important. Now there are some medication that can help. So there are some patients that with a hormonal cycle, they can get a little bit depressed, agitated, and things like that. And for the most part, I don't really recommend the medication unless those symptoms do affect their interpersonal relationships. If they get angry easily at their husband or their partner or their children, and it's really honestly related to the cycle and the hormonal changes, and then they feel upset about it or they cry about it, then it's not a bad idea to start a low-dose SSRI. And it's not forever, just to help those symptoms until they go through that transitional phase. Menopause is basically the end of your reproductive years. So there's no estrogen at that point. So symptoms would be more like dryness of the skin, decreased libido, possibly hair loss, depression, and moodiness. And again, exercise definitely helps with the symptoms. If the depression is to the point that it interferes with the person's lifestyle, I definitely do recommend treatment. And many have said that the medication really has helped them go through that phase without any issues. And like I said, they don't have to be on that forever, but it definitely makes it a little bit easier. And that's when at the onset of menopause, the discussions that you have is in regards to like bone density, help with a woman's libido if their libido is low. So with loss of libido during menopause, there is one supplement that definitely does help, and I've used it consistently. It's called, it's an amino acid. It's L-arginine. And you can get it from a very good nutrition store. It's once a day. L-arginine is an amino acid that increases blood flow. It doesn't really interfere with any other medication, but it can definitely help women who have decreased libido. Walking and weight-bearing exercises will help increase their bone density and prevent osteoporosis. So there are definitely ways to cope with it in a better way, and I think it's how you look at it. Some women look at it as more like they're free and there's a new life change and a new start to everything, and some women think it's going to be horrible, and I think the thing to see is that it's just a different stage of your life, nothing worse, nothing better, and there's different things you can do to deal with it to make it better.
Men also go through changes as they age, and what are some of the challenges male patients over 60 come to you for assistance, and what guidance do you give them?
Definitely, there is a change in men. They do have decreased testosterone. It's a little bit more subtle than our, I guess, in women. So their testosterone does go down. So what that would do is decrease energy, decrease libido, sometimes even decrease their hemoglobin level, and they are prone to losing bone loss and osteoporosis as well, just like women are. And so now we do screen men as well as women. In terms of testosterone supplements, very controversial. They only recommend it if the testosterone is leveled in less than 230, and if the patient is symptomatic very much. But have to realize that testosterone supplementation is associated with a lot of risks, such as atherosclerotic heart disease and erythrocytosis, meaning it's higher blood count. So and also the risk of prostate cancer. So if I have a patient that either has been started on supplementation, I always make sure to check PSAs on them to make sure that the prostate is not enlarging abnormally or they're not at risk for prostate cancer.
Thank you, Dr. Viana. What are strategies to maintain bone and muscle strength as we age?
After the age of 50, actually our metabolism really slows down, and they actually recommend eating 200 calories less than we usually were able to. But what's important at that point is strength training. So more than cardiovascular exercises such as running, biking, that kind of thing, doing weights, body weight exercises are the best. So push-ups, pull-ups, crunches, squats, those are actually very good. Machine exercises are good in that you're either sitting or laying. So if you're prone to getting dizzy or lightheaded, you're in a seated position. And then stretch bands are very good, doing bands. But the more muscle training you do and the less muscle mass you lose, the more calories you burn, and the better your metabolism. So women who do muscle training and lifting are less at a risk for diabetes than women who don't. So that's very important.
What health screenings do you recommend at various stages of life?
So there's so much controversy about the age of health screenings, or certain health screenings. And actually, when I just took the most recent American Board of Internal Medicine boards, there's so much controversy that they can't even ask a question, because for example, the American College of Gynecology and the American College of Physicians do not agree on the same thing. But for the most part, mammography starts at age 40. And some agencies recommend every 2 years. I personally make sure my patients get it done every year. There's so much research in breast cancer and so many treatments available, it would be a shame not to diagnose it and treat it. So I always recommend my patients get it at age 40 and yearly. If a woman is at risk, if her mother had breast cancer at the age of, for example, 35, they should definitely start earlier, and then genetic testing is always recommended. There is a recommendation that after age 75 in women, if a woman doesn't have a chance of living 10 years after 75, or the probability of that is low, a woman who is on oxygen, has emphysema, and a lot of comorbidities, if they don't want to have a mammogram, they really won't have to. But there are a lot of women that are in good shape, and there's definitely chances that they can live even more than 10 years after the age of 75. They should continue with their cancer screenings. So that's for that. Colonoscopy, which used to be at 50, is now at 45, just because they're seeing so much more colon cancer in younger patients. Very important, definitely. And in the past, I remember 10, 15 years ago, there was so much resistance. There were a lot of patients you had to convince that this is a good thing, that kind of thing. But now people actually come very willingly and actually ask for it, which is a very pleasant surprise. And I think the preparation for it is not as hard as it was before. I think the drinks that you had to drink or taste better and all that stuff. So colonoscopy is definitely important. For men ages 20 to 40, the only cancer screening is testicular cancer. And I usually recommend them checking for any lumps or hard nodules in the shower once a month and letting us know that, you know, if there's anything going on, we can order an ultrasound. And of all cancers, is the most treatable, even at stage 4. It's curable. And now one of the important thing that's around is a CT lung cancer screening. And that's for people who have smoked for 10, 20 years, at least a pack a day. It's very useful. And actually in the past year, I've had, I think, at least 3 patients I've counseled about smoking cessation who they did not want to, but they agreed to that test, and actually all 3 had lung cancer detected by this test and treated. It was amazing, just because had that progressed, they wouldn't have a chance for treatment.
Wonderful.
So, and then for men ages 50, we start with the PSA for prostate cancer screening. They do recommend in men ages 40 to 49 screening if there's a strong family history in their dad or brother or uncle. Prostate cancer is very genetic, so usually if a male patient has a strong family history, I do make sure I also refer them to a urologist for care.
Screenings are very important, for sure. Is there anything else that you'd like to add before we wrap up?
I think for the most part, preventative medicine is very important. You know, checking your cholesterol at least once a year, making sure you're up to date with your mammogram and things like that, because they can prevent so many issues in your future that could have easily been prevented. So just, I know a lot of patients are hesitant to come see their primary care doctor, but at least a physical once a year and doing your preventive screening will make sure you have a healthy life and you know, no major issues in the future. So.
Okay, great. We hope you enjoyed today's program. I'd like to once again thank Dr. Panna for offering us so much insightful information and guidance. We've included her contact information for those who'd like to get in touch with her. If you did enjoy this episode, please share it with your friends and family, and be on the lookout for the next installment of Live Well Bethel Park.